Good afternoon, everyone. I'd like to call our meeting into order for the March 31st, 2022 meeting of our Benefits and Insurance Committee meeting. Ms. Corbin, if you would please call the roll.
Rhonda Allen. Dr. Andrea Anthony. Doug Bodery. Amber Brown. Shay Crowell. Holly Deering. Brian Gaither. Mary Hickerson. Lois Miller. Alan McAdoo. Jeff Phillips. Shantae Sherrill. Steve Spence. Eric Tutobeni.
Here.
And Liv Guam.
We have a quorum, so we can now conduct our business. I'll look for a motion to approve the minutes from our last meeting. Is there a motion? Have a motion to approve the minutes from Rod Key. Barry. You didn't get it. Mary Hickerson. Mary Hickerson, now Rod Key. Just trying to get a little laughter, right? Okay. Is there a second? Got a second. Mr. Spence. Okay. Any questions? All those in favor signify by saying aye. All opposed. Motion carries. Next on the agenda is our financials. Mr. Elam, you're recognized.
Thank you, Chairman Ketron. For the 264 fund, month of February 2022, revenue $7,877,058, expenses $6,819,850. Revenue less expenditures, it was a positive $1,057,208. For the calendar year totals, $15,763,543 in revenue. In expenditures, $14,098,167. Revenue less expenditures, $1,665,376 to the good. Year to date for the fiscal year, $52,942,078 in revenue. Expenditures, $583,074. Revenue less expenditures is a negative $4,640,996. The 266 report for the month of February 2022, workers' comp, $2,557.83. OJI, $8,962.74. Total for the month of February, $11,520.57. Year to date for, the fiscal year is $45,351.99. In workers' comp, OJI is $292,443.38, and your total is $337,795.37. And that concludes my report, Mr. Chairman.
You've heard the report on both the 264 and 266 report from the director. Is there a motion to accept? I have a motion for approval. Is there a second?
Second.
Second. Any additions or deletions? Any discussion? Seeing none, if you would, all those in favor signify by saying aye. All opposed. Motion carries. All right. Workers' comp and OJI. Ms. Thompson. How you feeling not sitting up here? You liking it? Well, I'll turn your mic off then. Go ahead.
For February 2022, there was a total of 22 incidences, which brings the calendar year-to-date total to 33. Of those 33, there was 25 that are OSHA recordable, with 10 restricted days, 3 lost day claims, and 12 other recordables. On the next page, the year-to-date total for this year of 33 compared to last year of 36, and 2020 at 38. The incurred dollars for 2022 is $112,000, with last year's being $140,000 and 2020 being $100,000. And then on the last page, the of the 22 incidences, there was 17 at the Board of Ed, 5 at County General, and of those, there was 4 at the Sheriff and 1 at EMS. And that concludes my report.
Well, thank you, Ms. Thompson. Is there any discussions before she leaves? Any questions? All right, thank you. All those in favor of accepting the report signify by saying aye. All opposed, motion carries. Thank you. Next, we have our wellness update. Ms. Levitt? Hi there.
Okay, so for March of last year, for our annual physicals, we were at 1,126. As of today, we're at 810. For our biometric screenings, we were at 1,152. We are currently at 1,126. For our health assessments, we were at 412. Currently, we are at 307. Mammograms, we were at 479. We are up to 528. OB/GYN screenings, we were at 694. We are at 642. Colon cancer screenings, we were at 162. We are up to 220. And cervical cancer, we were at 696. We are up to 672. Prostate screenings, we were at 224. We are up to 227. Flu shots, we were at 1,895. We are now at 1,740. Working with a health coach to achieve a health goal, we were at 7 last year. We're up to 16. Also, to work with a health coach for chronic problems, we were at 5. We are up to 6. And completing 16 weeks of OMADA, we were at 3. We are up to 6. And let's see. For our current and upcoming activities, we have our mobile mammogram bus scheduled for various locations in May, July, and August. We have the MedPoint Clinic. We are all promoting the annual physical week starting on April 11th. And that's going to lead us into our next wellness challenge, which is our annual Step into Spring Step Challenge. This year we're partnering with Rutherford County Probation Office to match donations with how many steps to keep people encouraged to keep moving and to do good overall in the community. And that concludes my report.
Any questions? Levitt?
Thank you.
No questions. Thank you so much for the update. Thank you. MedPoint Report, Ms. O'Neill? Hi there. Well, thank you.
For our month of February report, if you want to go to page 3, we'll talk about our visit summary. In February, we had 572 visits. Of that, 474 unique members were seen. 257 were seen at New Salem, 168 at Stewart's Creek, and 147 at Walter Hill. On page 4, for our visit summary, we have seen 14,210 visits since we opened in September of 20 until through February of 2022. And of that, 4,356 unique members have been seen. On page 5, for our visit summary by member type, we saw 78 children, 427 employees, and 67 spouses. Page 6, on our visit appointment type summary, we had 62 annual visits, 11 dietitian visits, 370 established patient visits, 40 new patients, 25 nurse visits, 11 telehealth visits, and 52 telehealth virtual visits that included the video component. 77 members had more than one visit in the month of February. 5 members had 4 visits, and 72 members had 2 to 3 visits. On the multiple visits, most of them were a combination of acute visits with chronic care management and preventative care services. Only a few this month of February were related to COVID, so that was nice to see, versus January, where most of them were due to COVID. On page 7, we'll have our visit summary by day. We had 24 available scheduling days, and Monday was the busiest scheduling day for the month of February. And just to go along with that, just so you're aware, we did have a late opening and an early closure. We had the late opening on February 4th and an early closure on February 17th, and those were both due to inclement weather. I believe one of them was a tornado warning, and so we did adjust for that. On page 8, for our in-person versus virtual appointments, we had 63 virtual appointments in the month of February. Walter Hill continues to be the one with the highest average of virtual visit utilization. Of that, about 77% of the patients seen in February did so out of convenience, so they weren't sick. So I loved seeing that, versus only 23% being sick care for the month of February. So that was a big bump up than what it's been previously.
What do you attribute that to?
I think that people like it. It's convenient. They don't have to leave their homes. They don't have to leave their jobs. They can clock in on their lunch break and be seen.
But in Walter Hill specifically?
In Walter Hill specifically, I think that group of patients has been going to that location for a very long time. And so they're known very well by their provider who has seen them for a very long time. So it's really easy for them to take advantage of the virtual visit versus, say, New Salem, where there's newer providers and they may need to build that relationship before they can continue that care as much in the virtual platform.
Okay, thank you.
For our total visits, we had 14,210 visits since we started. Of that, 2,550 of them have been virtual, for just under 8% of our total visit total being virtual care. On page 10 for our referral summaries, we had a total of 56 referrals in the month of February. 26 of them came from New Salem, 19 from Stewart's Creek, and 11 from Walter Hill. 7 of those went to gastroenterology, 6 each to orthopedic surgery, the dietitian, and dermatology, and 5 to physical therapy, 3 each to endocrinology, counseling, and cardiology, 2 to otolaryngology, and 2 to general surgery. For our financials, we had 474 unique members in the month of February, a total operating cost of $159,549.94, a total employee count including retirees of 6,313 for a PEPM of $25. For our analytics, with our diagnosis codes, we had the encounter for general medical exam and acute chronic sinusitis pharyngitis being the top diagnoses for the month of February, but the encounter for general medical exam, again, is overwhelmingly the highest amount used at just over 21% of our visits. So we like to see that routine care, again, being at the top of the list. Then it continues on with essential hypertension, anxiety, viral infection, type 2 diabetes, bronchitis, COVID-19, of course, abdominal pain, and then contact or exposure to COVID-19. In our visit demographic summary, in February, 70.59% of the members seen were female, so we saw mostly women in the month of February, and the age range of 50 to 59 in both the female and the male population were the highest population seen, but there was still a good spread of ages for the month of February, with us seeing 44 children and even 6 people in the 80 to 89 age range. In our BMI summary, for February, the female and male member highest percent of BMI was in the overweight category of 25 to 29.9. I still see that as a bonus over when in the beginning we were seeing a lot of those in the obese category, and we saw a lot of them seeing the dietitian, so I'm hoping that shows improvement in our population. And then last month, I believe it was Commissioner Allen who had asked me about the breakdown of Board of Ed versus general county, and so we did a little bit of digging on that, and we found that 78.58% of the members seen were from Board of Ed. 19.54% were for county general, and 1.88% were retirees. So this includes the unique members, not the number of visits, so that's just the actual patient population. And that concludes my report.
Any questions?
On page 14, the diagnosis codes, where, let me get back to that, where you had the encounter for general medicine, would that be people getting their physical? Would that
Yes.
be? Okay.
Yes, ma'am.
Anything else from Ms. O'Neill? Seeing none. Good report, thank you.
Thank you.
Next, we have our Mercer presentation. Mr. Davis.
Thank you, Mr. Mayor. We just want to give an update on the projection with claims through February. So on the iPad, this is I believe the second attachment, or if you're looking at it on paper, it's going to be the projection. Everybody's got it. So with claims through February, using the same formulas we've used in the past months, we are only looking at the active population here due to the recent passage of the Medicare, or the approval from the Commission of the Medicare Advantage full replacement for the retirees. That is a fully insured rate, meaning that rate will be set by the insurance carrier. We're going to look at the budget for the active population. And again, with claims through February, we're at a 2% increase for the HSA plan, 0 for the copay, 0 for the deductible, 0 for dental, 0 for vision. So that aggregate total now, again with claims through February for 2023, is 1%. That 1% is worth $750,000. That does not include or take into account any of the savings from the Medicare Advantage passage. Really just an update from the last several months. Any questions?
Any questions for Jay? Mary?
I have a question, mainly looking through, over on the left-hand side, you've got projected claims plus plan revision. Is that the revisions that went into effect on 1/1/22, or?
Yes.
Okay, because right now, we've not changed anything yet outside of the Medicare Advantage. Okay, so that's what went into effect. These are the results we are seeing for the 2 months.
Correct.
Thank you.
Other questions? Okay.
I was going to pause there. So, Ed, is there anything, before we go to the next one, anything, the next exhibit?
Mary?
I guess a real quick question, with this piece of paper laying in front of us, not looking at the medical part of it, but looking at dental and vision, because both of those are pass-through cost to the employee. They're actually paying, they're getting what they pay for. There's no county input of money at all. So would it be, to kind of move this along, not that I'm rushing anything, but these two, instead of having these sitting out here to be overlooked or not, can we go ahead and make the motion for dental and vision to see a 0% rate increase for 23? Is that part of the purpose of seeing this?
I think that's appropriate. That's true. And talking to Mr. Elam, if the Board of Ed decides to leave and go to the state, things change.
So there again, we're sitting with not all the information, and we're going to look at this month, and I realize that these numbers are good. Okay.
Comments, Ed? Any
No,
comments?
I was just going to say, those numbers change depending on what's in our pool, so I hate to give too many rates out, and then you draw them back in, and then people are saying, oh, I thought it was this rate or this projection.
And I understand that. It's just that We keep looking and looking and looking with no answers from anybody and I do realize that the vote went out to all BOE and it closed last night, just from what I'd heard. That's all I've heard. I don't know numbers or anything, but we can't make an informed decision, and we're here on March 31st. So
Yeah.
now we're fixing to creep on into April, and we've got folks that work on budget, and I know BOE works on budget, I work on budgets, and I get it, because if they leave, we'll have to revote or rebid all of this. It's just, I'm sorry, I'm flustered that we don't have an answer of in or out. Sorry about that.
Well, it's not, it wouldn't be necessary, would it? Tell me if I'm wrong. But if the BOE decides to go ahead and leave, we don't have to make a decision quickly.
What we would need to be able to do is come to this committee next month, and we're going to come to you with property and casualty renewals. We'll also come to you with the insurance. Hopefully, we will have an answer, on what direction we're going to go, once the Board of Ed gives us some type of a answer. So I can't, until I am told otherwise, I move forward as if we're all one happy family, and here's kind of rates. But today, your second exhibit is just to give you that if the Board of Ed leaves, to kind of prepare you for next month. Here's some, again, we're making some assumptions, but here are some rates. Here's the difference in going to if the local government went to the state, or if we stayed on the Rutherford County plan, so when it comes in April's meeting, it's not everything log jammed at one time, and it's the first thing you've seen, and everybody's like, 4 hours later, is this ever going to be over?
So I talked to Mr. Elam, and I shared with him what we'll do next month. We'll take a look at the property and casualty first. The biggest issue there is our cyber. We're having difficulty finding markets that even want to offer cyber because of the state of the world right now and the number of hacks that are continuing. So we'll try to knock that out first and leave the rest of the meeting to address this. But what we want to do is move into the next phase of this presentation today, and three things. Where are we if we stay together, if BOE stays here? Where are we if BOE leaves and goes to the state? Where's County General? And where are we if we choose to go behind BOE? Three different scenarios to really look at.
And to answer the first scenario, Jay and Jake, we basically, with another month of numbers, claims, and everything coming in, the first exhibit you see should be, we're looking at 1% overall aggregate rate if everybody stays.
And I believe when we last met with Lori Lee about a month and a half ago, when she came down from the state, she said that it would take her towards mid-April. April?
They don't vote to the last of May.
Last of April, 1st of May, she'll know better of where they are at that point. Money's left in that bucket they've been borrowing from. Okay.
So our second exhibit is really just more for the committee to see, probably for the first time, if you remember the last couple exhibits had a blue box and an orange box. Well, the blue box was Board of Education, the orange box was County General. What we've done is we've removed the blue box and said, all right, if we assume that the Board of Education is going to the state, what does that mean for the County General, and what are the options that we have for this population of roughly 1,200 employees now? And remember, this is just active population. This assumes the same assumptions that we made the last two times. So this would be the state gets a 8% County General rate increase for 2023. 90% enroll in the narrow network, which is what the state currently sees. We'd have 39% in the Premier plan, 18% in the standard, 38% in the limited, 5% in the high deductible. Again, same enrollment that the state shows today for their county general population. When we add HSA cost, clinic cost, and assuming we wanted to add spouses like the state does allow, if you remember last month, I believe it was right at break even. I think it was $70,000 one way or the other for the county to go to the state, so it really wasn't much savings. But what we wanted to show you this month was, if the Board of Education leaves, Cigna's actuaries and Mercer's actuaries say that our underlying rates will increase 11%. So that $15.7, $8, $9 million budget that we had will now become $17.5 million budget because of that 11% rate increase because of the change in population. And now you can see that the state, if all the assumptions hold true, the state could show something along the lines of $1.6 million in savings, again, due to that change in population mainly. So we wanted to show you this because we haven't gotten to this level of detail now, assuming the Board of Education leaves. What does that do to the underlying county general rates? So really the entire difference this time is not that our rates are going up from a premium increase, or we talked about the active population, and if everybody stays together, it really is going from almost 7,000 employees down to 1,200, and that demographic shift.
Discussion?
Veteran.
Yes, Ed?
What you'll also see in this exhibit is that the enrollment assumptions that you make is like, if county general employees left, how would it look instead of where they are now, like someone might leave the HSA plan. And so, again, the same thing that we did with the LEAs, we took the same assumptions as far as enrollment to where it would mirror the state plan. And so when you look at these numbers like 39% Premier plan, it is the county, local government is different. The people that go on the state, move to the state, it's a different percentage. So if you compare this one to the LEAs, that's why you'll see those numbers are different as far as enrollment into which plan.
I have a question.
Mary?
The state rates, do they show the surcharge of not being on the narrow network? Is that $65-ish that I'd seen on some other stuff? Is that already in these numbers of the 855s or the, yeah?
It should be in those numbers. Those
So
are the
it's-
rates we were given as I believe you're now Tier 1 local government rates. Those are the
Okay, do
rates
we have that in writing yet? I mean, I hate to keep saying that. I know we've kind of got word of mouth, but
I've got an email,
I would
I'm
want to
pretty
make sure that we got that in writing, that we had moved up to the tier. But, so that 65 is in the 855. I'm just picking the first number here. It's not 855 plus 65.
More discussion?
Mayor,
Tanya?
on the top row, and I probably should know this, and you're going to say it, and I'm going to say, where it's talking about the different plans, state, Premier, PPO, 88.7, 85.7. What is that? What are those numbers? What are those percentages?
Those are the actuarial values. We've talked about trying to, because it's hard to compare, copay to a deductible, so it's the overall actuarial value of the plan. So meaning plan design to plan design, and if you remember in one of the meetings, I think maybe Commissioner Allen asked for some plan design comparison. So when you really get down to the details of the plan, how does something work if you need an x-ray lab, it tries to take all of that data and come up with some sort of a number to show plan design to plan design, not just looking at deductible, not just looking at out of pocket, but overall, how closely related are they?
So if I understand your explanation just now, you're saying the state Premier PPO is 88.7% inclusive of our current plan design?
No, so that really what that's saying in the state, I believe their calculation is around 90. So our model says 88.7 or 89, theirs is 90, but what it says is for every dollar in claim, the plan's going to pay 87 or 88.7% of that, and the member would pay the other 11.3. It tries to, you know, again, for an average claim dollar, who's picking up what portion?
Eric?
So I got a quick question about kind of more along the control idea, but as I understand it, you're trying to decide whether or not the county has its own plan versus joining or becoming part of the state, right? So if it becomes part of the state, how much control does the county still maintain over the plan in the future? Does the county then just surrender to whatever the state's whims are, or does the county maintain control over signing the...
Question. I'll let maybe Mr. Elam answer. Or
You have, if you're on the county plan, a greater amount of flexibility to change the plan, the, whatever part of the design you want to, deductible, co-pays, whatever. On the state, it's pretty much they have a commission that gets together and they look at theirs and they make their decision on how they want to do their plan design themselves. Eliminate it, take it away, and they just pretty much tell you, here's where it is.
So bottom line,
Greater flexibility?
no, not going to the state. State's going to dictate.
That's what I thought.
Yeah, state will dictate. We won't have any flexibility at all. We just take what they give us.
Right, that's what was my question was, because
That's correct.
I'm all about a cost-benefit analysis of, you know, what benefit do you get for what cost, but I'm also, you know, I don't like to relinquish too much control either, though. So for me, that's kind of a big factor. And also, I try to put myself in the place of a county employee since I'm not one.
Sure.
What would my reaction be to being told I lose flexibility? I might be willing to pay another percentage point.
Sure, and it comes down to control and cost, those two factors that you have to look at. You know, do you want the control and willing to pay more for the control than you are of the cost? You know, and then it comes back to the county commission. The county commission is going to say, well, okay, we don't have the same control that we used to. However, we don't have to put up the same issues. You know, they blame it on the state. That's what'll happen.
Well, I guess I try to put myself in the position of the one who has to use the services, so.
Correct. and it should be, because that's what you do. You know.
Like I said, I'm all about saving money. I'm all about increasing benefits, but I don't like to lose control.
Yeah. So, Dr. Anthony, Mr. Bodery, do you all feel if the survey or your count ended last night on the survey, do you feel confident that by this time next month we'll have some direction for this committee?
Yes, sir. We actually, it's on the BOE's agenda for April 7th, next Thursday,
Yes, sir.
to vote on the MOU for the state plans. We were hoping to have, we had discussed with risk management and Mercer back on March 7th, you know, about getting an updated actuarial evaluation with plan changes to see about staying on the county plans, if that would be an option. And, you know, with the state, you know, with BP funding, and we're still waiting on that. So, but hopefully we can get that from the actuary before April 7th to let the board see that. As far as the poll, yes, it closed yesterday. There was 96% of our employees that voted for the state plan.
Okay. So, Ms. Nolan, based on what you just heard, timeline-wise, does that give you enough time, or would you prefer that we call a special meeting to address it, to give you more time? I'm trying to help you and the county commission based on our timelines.
Well, what I would end up doing, you know, we have to present the consolidated budget at our first meeting in May. So if we knew something by the end of April,
That gives you enough time. Okay.
enough time to make a decision.
Okay, well, it's a timing issue, and just want to make sure that, but right now, based on the end of that poll, 96% of the respondents are moving in that direction, so it's incumbent upon this committee to be prepared to make those motions at our next regular stated meeting. Mary?
So when we get that information from BOE for next month's meeting, we will know if they're going. We will know what they're going to do with their retirees that will go with them. And they know that they will also lose the clinics, or have we being insurance department or whoever would work out an agreement that they can still use the clinics. When you've got 78.58% usage in our clinics being BOE, then
That will go away.
it would have to. I mean, it's not feasible for the rest of the county employees, so we would lose a benefit when BOE pulled out. So we're going to have answers to all of this so that we can make a hard decision in April.
Yeah, we'll have to. We'll have to make those hard decisions, so it could be a long meeting. Be prepared to come and make those tough decisions, so we make the recommendation back to Budget Committee and full commission prior to May, right? Lisa?
So going to the state, they have rates. And the question would be, for me, is then what is the contribution rate that the school and us would be making for the premium?
So will you be prepared, Mr. Boder, to come back and tell us what contributions you're going to make?
We have a recommendation to the BOE was just to leave it the exact same it is now on the percentage. Well, it's with whatever. There's a little bit, some of the plans have a little bit more, some less, depending on single, but yes. Single coverage on some are down to around 10, especially when you get into the local option plans. But we would, the point would, we would hold the same percentage that we have.
Lisa?
Then, since we don't cover spouses that already have insurance where they work, is there going to be a different percentage of coverage for that? Since we don't cover anything, don't even allow them, but the state allows them to come on, what would be the percentage increase that, you probably can't answer that, or maybe you can. What would be the percentage increase that the percentage of the premium that the Board of Education would cover for those spouses that have coverage somewhere else?
Us that on the thing, and we would just treat it the same way. When Dr. Anthony surveyed the other LEAs of the state, we found out we were the only LEA in the state that was excluding spouses that had something with their employer, that met ACA. So we would have the same percentage that a spouse that was, not offered, either a homemaker or one that was not employed at at an employer with ACA required coverage.
Other questions? Ed?
So your difference would be, based on now, is you could have a spouse that would go into the employee spouse or employee family. It wouldn't be just employee spouse, it would be employee family too.
Mary?
Okay, so if y'all are talking about the percentages of paying the contributions and stuff, so you would be contributing more to, because there's three premium rates on a state plan. County General take us out of it, and then BOE, I don't know exactly, anyway, BOE has two things, whether you're a teacher or a non-teacher. on the BOE payroll, so that's two different premiums. So will you adjust your percentage contributions based on their premium cost? Because if you have a custodian premium, I just like round figures. So if the custodian's individual is $100, but the teacher's is $75, so is the percentage that you're going to pay, you're going to actually put in the 80%, 20%, 10%, or whatever it is. So you would be paying higher for your custodian than you would be paying for your teacher in the plan.
The active BOE employees, whether certified or classified, have the same rate on the premium. That's the difference is the pre-65 retirees.
Yeah, pull your mic. Pull your, all right, everybody pull the mic up.
Nobody wants. It's on.
Well,
It's on.
no, but pull it closer to your mouth.
Is this on?
Oh.
Ooh.
Yeah, there you go. It's the active BOE rates, the premiums for both certified and classified, or the teachers and the support staff, they're the same for active employees. It's the pre-65 retirees, the certified personnel have a different rate, a premium than, but that's the pre-65 retirees. But the active, which is the meat of what we're talking about, same rate, same premium. Do the same percentage, the janitor would have the same premium as the teacher.
Sonia. Oh, go
I'm
ahead.
sorry, the follow, with the pre-65, the state contributes toward the teacher. Bring it down.
And since they're talking about retirees, that's one of the things that when we do come back, I do think that we need to, you know, Mary brought up the point about the clinics, because that's one item that's out there, but the other is the retirees. And I think we need to decide, or I don't have a vote, but I think this body needs to decide that that we know that the pre-65s go, or anybody who's an active employee in a pre-65 would go to the state with that, but then it leaves the current retirees, you know, do we leave those here, or do those individuals have to go to the state? And then we also need to consider those individuals who don't meet the criteria for the state's criteria for retirement. You know, what happens with those individuals? I mean, so, for example, if somebody at the Board of Education decides to retire later, this is just to have a food for thought to be thinking about for your next meeting. There's like some 3,000 plus employees that already are disqualified for pre-65 retiree benefits through the state plan based on what's pulled. And I'm not talking about county general, because there's some confusion when the state watched this the last time I made the comment. I'm only talking about Board of Ed, which it's different for the county. We need to talk about if those individuals don't qualify under that and they qualify under the county's, is the county going to let that Board of Education employee, if they qualify under the county's pre-65 retiree, stay on our pre-65 retiree plan even though their active population has gone to the state? That's one of the things that, because that will be a question later, maybe, you know, not next year or the next, but for Ed and his team, well, I qualified under the state plan, I didn't qualify under that, do I get to keep it? And so if they're no longer contributing to the premiums with the active population, that does impact the retiree fund. So I just, thinking about that group of people who are hired after the July 1, 2015, they may still meet our criteria under our bucket list that we have at that age, pre-65, they may qualify. Is that something that the county is going to continue? Because that will change things as well. So I don't want it to be that there's an assumption out there and it's unclear for Ed and his team to have to try to manage, you know, 2 or 3 years down the road, because that would be a big deal a couple of years down the road.
Yeah.
and what you're referring to is the cutoff date that the state has, July 1, 2015. There's, what is it, 3,000, something like that?
They were grandfathered.
I didn't mean to put y'all on the spot, but there's somewhere close to 3,000 people that have been hired past that 2015 date. And that's one group of people is, what do you do with them? Because the state says they get no benefits after 2015, July 1st. But they've been working for us thinking they're working towards the stipend plan, most likely. That would be one of the issues. Another one of the issues would be eligibility. If you're supposed to be on the, county plan for like, say, 15 years, and right now you've only got 13, yet you go to the state, you can't be on the county plan and the state plan at the same time. So what are you going to do with those people who have not met eligibility, whether it's age, years of service, or on the plan, on the health insurance plan? How are we going to handle that? And then the difference in eligibility with the state and with the county also, with the years of service difference. When the state has I think it's 60, you have to meet TCRS first requirements. Is that right, Doug? And 60, and 10, and 1 year. Is that right? What?
In all fairness to the Board of Ed, 924 of their employees would not qualify under our criteria, but would qualify under the state based on their years. So there's, not to make an assumption that there's not a group of people that are not going to get something, because I don't want to mislead anybody. My thing is saying whatever we do, just so we have something that your office can administer, that we understand, like, this is where the line is in the sand, one way or another, either way the body decides to go. Because of those individuals that would go to the state, like I said, 924 of them would be eligible under the state, which would not meet our eligibility. But then the 3,270 would not meet the state's eligibility and would not meet our eligibility because they're not on our plan. And then the rest of them fall out somewhere in between. So we think there's probably looks like another about 1,400 or so that would meet the state's criteria. They just wouldn't be eligible for the pharmacy or whatever. So my concern is not about the people who meet it or not about the people who would fall under theirs. My concern is about that group, that population that maybe in their mind they say, I've been with the county, I've been with the county for 20 years and I'm age 60. Why don't I meet it? It's on the plan part. And in their mind, some people may think in their mind, I've been participating in insurance for these 15 years, so I qualify. And they may not understand that the county's plan and the state plan, I'm just anticipating more that may come in. I just want that to be something that we kind of have a resolution on how we're going to administer it one way or another. Just, that's all I'm worried about.
Mary?
Okay. With the thought of talking about administering it and everything, surely to goodness we're not expecting Ed's 5 or 6 or 7, I don't know how many you got, in the office to help, and I don't want this to sound ugly, and I'm trying, but to help BOE get them to the state plan, and then they've got to do everything else they've got to do for county general. Surely we're not looking, because when BOE pulls out and takes their money to the state plan, that takes money away from Ed's department that gets paid out. There is some funding there, but basically Ed's department gets paid out of and can base a budget on dollars that go into the insurance fund out of our county employees' premiums that we pay out of our payroll check. I mean, the biggest part of all of that pays the claims, but there's still a little bit that helps with your office. So if that money gets pulled in BOE's portion, goes to the state, and they get all that money, we're stuck not getting any money. So I would like to think that we're not asking Ed's office to do it for free. They're having a hard time doing it now for what we pay or what they make and everything that they do. So I don't see how that we can administer something when you've got two plans and it needs to be handled at that point in time as two separate plans, and they need to be aware that you're either with the county doing whatever county general does because we're general employees, or your BOE doing what they do. It's always been a distinction, but now it's fixing to be drawn a line in the sand, and it needs to be made known that way. So another thing that I have as a note is to help, that I'd like information for April's meeting is, are the BOE retirees currently on our plan now through December 31st staying or going? Because we do have that our plan is changing in January of '23 for our post-65s to go to Medicare Advantage. So I think something that we need to have for us to think about is it going to be just a few of them left, or is it going to be the whole pie of 400 or 500 something retirees we got? That's something else that we need to know in making the decision. And then we're talking about the eligibility and everything, and this may be coming up later in the meeting, but something that I'd thought about and then was also brought to my attention, we have the Gatsby liability. Now we probably need to, if nothing changes, I think we still need to look at it, because I think our language for Gatsby has to change based on us putting the Medicare Advantage plan in. That would give everybody that's on the Medicare Advantage post-65 the pharmacy that some don't have now. So that may be 2 months down the road, but that's something that we need to look at also, because that got affected when it got passed the other night with the Medicare Advantage for our post-65s.
Mary, you're very astute in all the things that you have just brought up. Mr. Elam and I have talked about this. This will be an educational challenge to educate. If BOE does go, his department's not large enough to handle that process and everybody being concerned. We would like to know from BOE what is going to occur, how will that transition occur, how will the enrollment, how will you get everybody over and educate those teachers without them calling Ed and jamming up the lines, what's going to happen to my insurance, and he can't handle it. The Gatsby language will have to be changed. There's a lot of things. That's why I say come prepared. We might be here at the next meeting for a long period of time, because there's so many things that need to change.
We just lost our quorum.
No, we're going to drag you back in here for the quorum, okay? Matter of fact, we have Mr. Spence. We'll just go out and pick him up and bring him in, okay? You can't. All right, Doug.
Food, and that way you won't have to worry about people showing up.
Yeah, we'll bring in some food, right? Okay, Doug. Can you hear, Jeff? Hold the mic closer. Hold it closer. Like those guys in Las Vegas. Like you're touching the mic with your lips.
That one.
There you go.
won't find the right button here. I apologize. Okay. Real quick synopsis of that was, we have in the budget for the BOE that we're going to present is 4 employees for agency benefit coordinators that would then work with Ed's doing, his office is doing right now. They would do that under Dr. Anthony's office with the state plans for the active and pre-65 for the BOE. That's funded through some of the savings that we're going to recognize going to the state. As far as retiree coverage, we have looked at this for the entire last 12 months at the BOE, and we have this, and I've been talking with Ms. Nolan on this too, and we're going to hammer this out next month, is that we have it set where no BOE employee or retiree would lose any post-65 or pre-65 benefits. We actually, on that side, on the BOE side, we would actually see, because right now the cutoff for any type of insurance for pre-65 is 2010 right now under the current state or county rules, 7/1/2010. Well, the stipend, but I'm talking just besides the stipend is actually the insurance. Actual insurance would be, with 7/1/10, that would be extended to 7/1/15 cutoff under the state plan. And of course, the discussion is how would we keep the ones from 2015 forward under the HRA with the stipend plan, and that would be, of course, the discussion is talking. And once again, we're going to jump into the next meeting is, of course, look at using remaining funds from the insurance, the self-insured plan, to do an OPEB trust, and of course fully fund that and actually reduce OPEB. So not fully fund, but I can be optimistic, but it's for portions. But that with the Medicare Advantage plan, if we played our cards right, we could see a decrease in OPEB.
Okay. Lisa?
Okay. So, no surprise there. Again, I'm Lois, I'm sorry, and Sonia, sorry. I told Doug I had hoped I'd never have to live through this again, but I think that we have to open up the OPEB discussion from scratch and say, what are we going to do?
I agree.
Because as you said, those people that go on the plan, we built that based on a county-funded plan and wanting to give something to somebody with that stipend, with the thought that those funds would remain in our insurance fund if not used. Well, if we don't have a fund, that's out. If you talk about whether it's on the, I know this is easy to say, but are they on the county plan or state plan? It says, our plan. Well, to meet 15 years of on the plan, and assuming every year that they were hired, they were on the plan, then anybody hired after 12/31/2007 can't physically achieve that if we hold tight and said you have to be part of the county plan. It can be open, but we've got to me, we open that up and we decide how are we going to do that. You've got that group between 2010 and 2015 that have the ability now get something different than what our GASB had set.
And see, that's an educational process. Nobody knows that ours went into effect in 2010, state went into effect in 2015. There's a whole group of people that are in there, and that educational process is going to be very, very confusing. So to go back to your statement of starting over.
Starting over. And so I go back to the eligibility. It's like, okay, what does the state require for a county employee to get a benefit? What does the state require to be able to access the insurance? To be able to pay a premium to be on the state plan? And it's you know, for the county, you have to retire from TCRS. That's number one. Well, TCRS has those rules. They want you to be able to retire because they're going to attach that premium. They're going to get their money. So that's number one. Then it's years of service, and some it's 10 and some it's 20. And then continuous years on the service. Continuous years on the plan immediately prior to retirement. With 10 years, it's only, you'll have to be on the insurance plan 3 years. This is the states. Or 20 years, you'll have to be on the plan 1. We made it, you had to be on the plan to get a benefit. And maybe that's a difference. And I lost sight of it myself when I first heard. It's like, oh my gosh, everybody's going to be able to get it, to get the insurance if we go. No, it's like they have access. The question is, how much is the county going to contribute toward that benefit? And that's the things that I had to come back to. What are we going to offer?
And the county commission has no idea at this point. This is going to come as fast.
So to your point,
Tanya and then Mary.
to your point, one, if their criteria is, and I haven't looked at it, but I think the criteria for the county is different than the LEAs for as retirement goes. It's a different. I've got the list here, and I'd have to look it up. It's not the same thing. It's different buckets. Like we have different buckets, they have different buckets. So the criteria. So then you're looking at that plan for two different groups, and then I don't want to lose sight that the 2010 for us doesn't mean that you lose retiree benefits for pre-65. What the 2010 for us is we get you to 65 where you'd be eligible for Medicare. Excuse me. So an employee
There's some water.
I think I'll be okay. Our employees, we don't have a cutoff with hire date. It's just at that point they don't get to have post-65. So somebody that's hired in 2000 under the current structure, 2030, as long as they meet that criteria, gets to keep their pre-65. So somebody hired in 2030 who's 20 years old and gets 20 years of service with the county at age 40, they could have pre-65 retirement. And so I think we're not being clear about that, because it's the way it's coming across is it's implying that the county removed the benefit 5 years before the state did, and that is just not true. What the county did is said, 2010, we will let you have pre-65 to get you to Medicare, and after Medicare, you leave our plan and go to your own thing. That's a totally different thing than in 2015, you have no pre or post-65. Those two entirely different discussions. The other part is, if we look at it, and part of the reason why we did it the way we did is because, and I remember, I don't know if Jeff Sandvig's in here today, but one of Jeff Sandvig's things was from a recruiting tool for the Board of Ed was the way it was structured before. Somebody would come and they would work for the county for 5 years, and the last 5 years of their career, and then they would leave and they would get our insurance for life. And so the whole purpose in putting some teeth in the game is we wanted to retain people. And so to your point with the 1 and 3 or whatever the criteria is, yes, that might be a recruiting tool to let somebody keep it, but it also means that we may be getting somebody in at the end of their career that are just using us for the benefit, which will be a cost to us. So it's kind of, no, I know. I'm just saying those are, I mean, like this, probably the insurance, the active insurance is not the hard decision. The hard decision throughout this whole process is retirees. That's really going to be the hardest part. The active employee population is easy. I mean, you look at the premiums, you look at how the claims are paid out and those type things, and that's pretty easy. It's what happens at retirement. That's going to be the hardest piece. If we were to ask if we were going to go to the state plan as a county general side versus Board of Ed, that would be the hardest piece, is determine how do we value our employees who have worked for us and are expecting, or not expecting, hopeful that they have a retirement plan with the county service. And I think that's the hard piece for me.
Mary.
Kind of going on with what Sonia said, talking with the Jeff Sandvig on the 5 years at the end of the career, the purpose for the years of service and the years on the plan is we are self-funded. It is our premium money coming out of our paycheck that is going into the savings account that a check gets wrote to pay Dr. Joe, okay? So if a retiree hasn't put his fair share in and expects to get it, then I just think you ought to be able to contribute to the cause. And coming in last 5 years of your working career, and so that was the reason why of putting a tighter or a tighter thing in that it's 5 years on the plan or whatever the different pieces of the pie is because you've got skin in the game. It's been your money. Now, granted, I've been here 27 years, and thank you, I've not had to use a whole lot of it, but I've been able to put in so that the ones that are on the pre- and post-65 retirees and the other county active employees have been able to use my money, and when I've used it, I've used some of their money out of the pot to pay for the bill. Because it's all one pot, it's all our money in that account that writes those checks. Cigna negotiates the price with the doctor. Rutherford County writes the check to the doctor for the 20% or the 80% that's left of the bill to be paid if a deductible's met. That's what a lot of people don't understand. And when it got explained, and when we went through all of this to draw the line in the sand on 12/31/2010, that it's our money. We're not the state that has 95 counties, 94, if it's be 95 if BOE goes, that is putting into a bigger pot. So they have really spread it out. But when you have a retiree that leaves and stays in our plan, they've put the money towards it and we've put the money towards it. So if you go outside of putting, when they go to the state, their money's going to the state. Their money's not going back into our self-funded insurance fund. So I don't see how any of that would be possible to project when they've quit putting in. And that's what's going to happen is they're going to quit putting in. Now, with that being said, Doug also mentioned that they've looked at this for 10 or 12 months. Or 12 or 14 months. So my statement for us as county general that would be left is not to do a knee-jerk decision that affects the 1,200 plus employees that would be left. If it took them a year to decide, we shouldn't have to decide in a month or two or in a couple of hours because it's very important to us. So let's just keep it in mind. A big employer like BOE took as long as they did to make a decision. I don't feel that we need to do a knee-jerk decision because they walk out.
All right. Other comments? Discussion.
I have a question. Doug, you said that 96% of the people that responded wanted to go to the state. Can you tell us how many actually responded of all your employees?
We had over 2,000 respond.
Jeff?
I felt pretty good before I came. Now I'm just confused as hell. I had someone come up to me after the health and ed meeting Tuesday night and said they have heard that the county's going to drop pre-65 coverage. And I told them that's one of those things that are out there that I think is fictitious. So let me just, Harry said, let's do things simple. I like round numbers. We don't make any changes. The BEP, the Board of Education, does not make any changes at all. We won't have any changes, right? We'll continue along just like we are. And if they do leave, the county will still remain just like we are. So if that person that asked me is a pre-65 getting ready to go to post-65, benefits. And I would know, my response to that person would be, I have no idea. I don't know what's going to happen. And it all hinges upon what the Board of Education does. But from my perspective, dealing with the county, we're not making any changes to post-65, pre-65, or post-65, either one, right? We don't have any plans to make any changes, correct?
Well, I think at this time, you have different eligibility with the state than with the county. So are you going to hold Board of Ed employees at a certain type of eligibility where they can retire at a different eligibility than what county general? So I think what we have to do is we have to look at what the state eligibility is, retirement, pre-65, and then we have to look at, what the county is. And are we going to keep that same stringent 60 plus 20 plus 15, 60 years and 20 years with the county and 15, or are we going to move more towards what the state is? I think, to answer your question, Commissioner Phillips, it is pretty complex at this time trying to compare the two and then figure out what we're going to do. At this point, the rates were a blended rate. So you had the blended rates with Board of Ed and with County General. Now, it's not a blended rate, and as Mercer has pointed out, we're looking at 11% increase on the County General employees. So, myself, I can't guarantee, we'll have to look at some numbers here in the County Commission. We'll have to look at some numbers and see, is it worth going to the state, the County General going to the state, or staying? I think that's what Mary is saying is we're down here to the clock striking 12. Yep. And I don't think Mary, she stated, she doesn't want to make a decision in 2 hours, what we're going to do. And I think, to answer your question fairly, I think we do need to go a little bit slower at this and make a decision and pull all of these eligibilities in and sit down and just compare apples to apples and how it affects the county general employees.
That's where I said there's going to be an educational process, and it's coming at us quickly because Mary doesn't want to make that decision quickly, but right on the heels of that is 21 commissioners sitting out here who's going to have to make that decision quickly as well. So
let me just kind of rephrase if
they
I
won't
can.
like the 11%, I know that.
If the Board of Education decides to stay where they are, everything will probably remain just like it is. That's the simple answer that I should give if someone come up just like they did at the Health and Ed, after the Health and Ed meeting the other night. If everything remains the same there, if the Board of Education remains with the county, then there'll be no changes. We don't have any changes planned.
This was the next subject, to do some house cleaning here. But to answer your question to that, no changes. We have what was put out by the Board of Ed from AON. This body voted with the recommendation of years past to eliminate the high deductible plan. It is used to measure whether we're equal, superior, or inferior to the state. And we chose, because that's what it was talked about, to eliminate it years past. It was voted on to eliminate it by this body, and it has not moved forward to the County Commission, waiting for a decision for the Board of Ed. With it being removed, it is the one that qualifies us for the BEP funding, whether inferior, equal to, or superior, and it qualifies as equal. And so it meets the criteria for the BEP funding. If the Board of Ed goes away, we can still eliminate the grandfather deductible plan. If the board decides to stay, then we will either need to do, and that's what Mr. Bodary was talking about earlier, we would need to do two things: either add the deductible plan back in and open it up to everybody, or make some changes to the plan that we have, which would be the copay, and that's what Mr. Bodie was talking about, and that's what Mercer was talking about. What can we tweak in the copay plan to make sure that we meet the qualifications we need for the BOP funding? So to answer your question, there might be a small change in order to meet that. And what I mean is minimum. If they stayed, we would need to vote on putting that grandfather deductible plan back in and opening it up to everybody. That would be one. Or I think we're talking about Jake and Jay on the copay plan, just changing a few of the either deductible or copay.
It was a deductible change as an option 1 and out-of-pocket change option 2. A slight, again, it's 1%. We're within 1% of being in the range.
So that's if the state plan does, which they may.
Because we're comparing to the state premier plan. If they were to change their deductible 1%, then we would fall into the, without even having to do anything on our own. So
Let me rephrase it for the third time. If we feel those questions again, it's not the counties, Rutherford County, the government of Rutherford County, and to make any changes whatsoever to the plans of pre-65 and post-65. If certain things happen, such as the Board of Education, it opens up everything for some type of consideration depending upon on cost analysis and what it's going to cost the county and also the employees. So it's not our intent to make any changes. But if the Board of Education decides to go in a different direction, it may cause us to have to re-examine what we're doing, both pre and post 65. Yeah. How's that?
You would be correct.
That's a fair assessment. So you can go back and tell them exactly what you said. Okay. Eric.
Yeah, I just had a couple of quick questions that help clarify it for you. First, I have a Mercer question. You said that switching to the state plan, it would be about an 11% increase, was that right? And what did you say it was if we stayed the way it is, if we didn't switch to the state plan?
Which, if we stayed
the same way,
our base rates would increase 11% because the Board of Education left. The county general rates would increase 11%.
Okay.
It would not be an 11% increase to switch to the state.
Okay.
If we kept our plan the same, we would need to increase our rates 11% because now we only have 1,200 employees versus 7,000 employees. Correct.
And if the employees stayed the same though within Rutherford County and nobody left, what was the increase then?
It was 1% on the actives.
1%.
Not counting the 1.4 million or so savings for the Medicare Advantage. So very well could be in a
1%.
zero-ish.
Okay.
Yep.
Okay. Now I had a question. Oh, Mr. Boder. Oh, there he is, still there. I thought he left. You said that 2,000 people responded, and it was about 96% positive. Is that right? So that's overwhelming. So what was the attraction then to switching? Was there anything in particular, or was it just a general?
For the last 12 months, we've had the state give presentations. We had the county plans invited over. We videoed those things. We put out all sorts of information from the state documents to our employees. We encourage our employees to review that multiple times. So based on, after we educate our employees, a lot of the things that are being asked today is, what about pre-65? If I'm under pre-65, if I'm under pre-65 right now, under the county plan, then going to the state plan, I'm under pre-65 with the state, with a comparable plan. No one loses a benefit on that. So that's, to answer your question, that's what happened, was a lot of education over the last 12 months of our employees.
But no, I understand the education part of it, but obviously what they saw is something that they want that they don't currently have. They want to make the switch. So
The actuary evaluation from the state showed, better plans, more options for plans, and lower premiums.
Okay.
Spouses.
And my last question was, so as far as the state and the county goes, how did this initially get started? Did the state pursue Rutherford County, or did Rutherford County pursue the state? Any idea on that?
Well, I don't think Rutherford County, from my office, pursued anything.
So
It
did
came
the-
from BOE.
So did the state, they came in and said, we'd like to offer this to Rutherford County, or was it Rutherford County?
I don't know that, Mr. Bodie.
The BOE requested a study
BOE
back a
requested,
year
okay.
ago, formally requested a study to compare the state with the current county
Gotcha.
plans after
Okay.
the preliminary rate increase of 10% was thrown for 2022 and 17% for 2023. So that's
Gotcha,
when
okay.
the BOE requested that be looked at.
BOE, okay. All right, that's what I needed to know, thank you.
I do have one question, and then Lois, I'll come back to you. In the questionnaire, Mr. Bodie, that went out to all the employees that voted, was there anything in there showing what the employees would be giving up if they went to the state? They're going to have to go to Doc in a Box or CVS or anything else. They're going to be losing the opportunity to go into the walk-in clinics that we currently have. Was that explained to them?
That's been discussed as not utilizing the clinics as it is currently, and then just utilizing the clinics that's available under the state plans, which are under the county plans as well. But that's been discussed, and
But it was
multiple
was it
times.
on the?
It's not on the survey.
It's
It
not
was
on the
just, did
survey.
you want medical
Okay,
insurance?
Lois.
I guess I have a question for the Mercer folks. So you've been part and parcel with us through this entire journey, and I'm sure you guys have seen here in the state of Tennessee these same sort of discussions going on in various counties. Is there any way you could bring to the table the differences they saw and how they handled it, especially as it pertains to the retirees, and just in the smoothness of the movement itself?
I would say of the groups of your size, we are not seeing this, and I think it's largely due to what we said before about losing the control. I mean, most groups of your size want that control to be able to decide on your own plan designs, your own carriers, on-site, off-site, things like that. And so that's largely what it does boil down to a lot of times, is more of that control.
Tanya.
It prompted a thought whenever Mr. Tudor-Benning asked about the number of people that participated in the survey, and that 96% said that they wanted to move. I thought that I had heard that 50% plus one of your total employee population had to want to make that move, and that anybody who did not complete the survey was a no, and anybody who did it. So you've got some 6,000 employees, right? So if only 2,000 responded, that leaves 4,000 that said no.
Eligible. So we're happy to open it up. It's at
What do you mean?
96% eligible for insurance. So the part-timers wouldn't be eligible. So you
Gotcha.
would not include
Gotcha.
anyone
That makes sense. Okay. I was like, how do you have, that doesn't come to 50% plus one. So,
Your math wasn't adding up.
yeah, like Lisa says, stick to
Other
paper. not
questions?
numbers.
Barry?
Just to make a statement to something that Mr. Eric asked early on in the discussion is, what does this mean? This is a perfect example of what switching to the state or staying here, this is a perfect example. We have the option to sit in this room to make these decisions, these discussions, send it on to budget, sending it on to the 21. Whereas if we needed to tweak the copay plan, some dollars or a percent or whatever, we can do that here. But at the state plan, if they want to do it, sorry about your luck, it's done. And it goes back to, I've been on this committee a long time, and I hadn't been on it very long till we had an employee come because there was a device that was not covered under our plan that their child needed, and I sat and listened to it, and at that time it was a smaller committee, we all listened to it. It was brought by our advisors that these devices are starting to be covered now. This is years ago. And so at that time, the committee said yes, the commission said yes, and it was a lady, I don't know why I remember that, but the lady went on knowing that her child would be covered for this device because she approached our plan. So we have done that in the past for different things because we are self-funded and we have this committee and we have 21 commissioners that do their homework and do their job and listen. They've made changes off of what we've sent, but this is the example of what happens if you go to the state. You lose this control, you're at, best of luck to you.
And if I might respond to that a
Eric.
little bit. Yeah, so, and I'm with you 100% on that. So if the BOE, though, if they do decide to leave, so you're left with an 11, how many employees are remaining then in the county?
About 1,200.
1,200. So for that 1,200, though, there's no way of getting around the 11% increase?
We can look at plan changes. I mean, that opens it up to we can make the plan how we want. So there is a way to not have an 11% increase, but just from the underlying census demographics, 11%.
No, I
But
got
absolutely,
you, yeah.
we can look at,
That would be the
again,
next meeting.
that's the
is
next
going
meeting
through
is-
multiple scenarios to get that down.
So it's not a foregone conclusion that there has to be an 11% increase. Adjustments can be made. Again, I'm not on the receiving end of this, so the people that it affects the most are the ones that really need to weigh in. So I guess I'm kind of like a control freak. I don't like to give up control. But I also like to save money and have better benefits too. So
Yes.
thus the tension.
Yeah, even if we could make adjustments to get around the 11% increase, there's going to be an increase because we lose all economies of scale. So our management fees that, to pay the claims and that sort of thing, that just the actions of.
No, I'm following, but what would that number be then? Because if it's only 2%, not that big of a deal. If it's 8%, then that is a big deal,
At one point, Cigna had mentioned something about 9% just in economies of. Our stop loss
That's
premiums
huge.
would have to change, our levels would have to change, all that would go up. And then the Board of Ed has made a good argument in several cases that they do help support the county population. So that probably equates to the other 2%.
And I can see why this is going to be an extensive meeting next time.
Yeah, bring your sack lunch. Other questions? Other questions? Comments? Ed?
I'll finish up here because I think the Board of Ed needs a little bit of housekeeping from us. And that is that to ask a motion and a second for Mercer and us to try to get with the state, make sure that we make the changes we need to. If the Board of Ed does vote to stay with Rutherford County, that we open up the grandfathered deductible plan to everyone, or we make what changes we need to in order to get in that range for the state to qualify for the BEP funding on the copay plan.
You heard the recommend, Doug.
What I'm asking is that to get from this committee a motion to give us direction. We're not going to do it. We'll come back to you next month. Of course, it'll be a moot point if the Board of Ed goes, but it's just to give the Board of Ed that direction that we're going to do one of two things. We're either going to open the deductible grandfathered plan up to make sure that it's used as because you have to have it to meet criteria 1, or to make the changes that we need to make to the copay plan.
Okay.
I'll make a motion to open up the deductible plan and see if that will meet the superior equal to.
And come back to the next, at the next
Come back
Benefits and Insurance Committee meeting. Is there a second? Got a second from Chairman Phillips.
And this is not just reinstating it, this is opening it up for everybody.
Okay, I have a discussion on that. This is to look at doing it.
Yes.
This is not
Not to do it.
putting it in
It's not.
that we are going to do it.
No, it's not to do it, to look at it.
It's to look at it.
That is the motion. Is that correct, Doug? All right. Everybody understand the motion?
And we'll come back next month. We'll come back next month. If the Board of Ed leaves, then we'll go back to
Correct.
what our original, if that's what the wishes of this body is, to go back and eliminate it, then that's what we'll do, because we won't need it to meet the criteria of the Board of BEP
Okay.
funding.
So it's to look at tweaking copay and possibly reinstating and opening deductible.
That's not his motion.
Okay.
You want to restate your motion?
For actuary valuation to look at, to meet the superior or equal to test with the state, to have both options to, if the deductible plan was reopened for all, or if the second version would be tweak the copay plan to get to the minimum.
Have a motion and a second. You understand the motion? Okay, you're good with that motion. Mary, you understand it? No? Okay. Well, let's go ahead and call the roll, Ms. Corbin.
Rhonda Allen.
Yes.
Dr. Andrea Anthony. Doug Bodery. Amber Brown. Holly Deering. Mary Hickerson. Lois Miller. Jeff Phillips. Shantae Sherrill. Steve Spence. Eric Tutobeni.
Chairman votes aye. All right. Motion passes. Anything else to come for us? Ms. Allen?
I know you said next month we're going to have a lot of different scenarios to consider, and so I just made a couple of notes. One of the scenarios I'd like to look at is it worthwhile for us to consider adding spouses back in? Because then you're going to increase some of your premiums from, single and child or single to family, and so that's going to help. It may very well be that, the cost for those claims isn't worthwhile, but it's one of those things I'm curious if we don't need to at least examine. And then also that's going to drive up a satisfaction level. If I am able to bring my spouse back on and my premium's going up a little bit, that might soften that blow a little bit, as long as it doesn't hurt us too badly on the claim side. The other question is, since we do have almost 80% of the school board being the folks that are using the clinics, I think we need to really look at, as we factor in that cost, is either eliminating the clinics or modifying the clinics. I don't know if you want to go down to 1 from 3, or if you want to go more virtual. I'm not sure how you would want to do that, but that may be something we want to look at as well as a cost savings measure.
Can I address that really quick?
Ed?
So, Commissioner Allen, what we've got on the table is maybe pull back to just 1 as an option, and add the occupational health to it, drug screening, physicals for firemen, things like that. And I don't think, yes, Amber's still here, but so we've been in contact with Ascension St. Thomas, trying to figure out, is it feasible to drop back down to 1? And can we save that money with occupational health with them doing our physicals? That's one. I have been in talks with another county about sharing, and I don't believe they're going to be able to put it in place fast enough for what Rutherford County needs. So I don't think the partnering with another county is going to work out at this time. But and I haven't got the numbers back. But other than that, I don't know of any other options on the table. If the Board of Ed leaves, I don't know of any other options.
Other comments? Anything else to come before the board? Seeing none, we'll stand in adjournment. See you next month.